Hello, my name is Abhineet Chowdhary. I'm a neurosurgeon in Scottsdale, Arizona, and I work at the Southwest Associates of Neurosurgery, also known as SWAN. So the SI joint is a very interesting joint. It's actually one of the largest joints in the human body. It's located at the base of the spine, where the spine and the pelvis meet in the lower back. So SI joint pain is actually a lot more prevalent than people think. About 15 to 30% of patients with low back pain, it's SI joint related. A lot of the common causes include pregnancy, trauma where there's a direct impact where you fall down. That includes car accidents, as well as work-related traumas.
Hi, my name is Leigh, and I'm a retired healthcare executive, and I had the iFuse procedure 10 months ago. Over 30 years ago, I had a fall in the garage. Unfortunately, the pain was very difficult. I used to walk 5 miles a day. It was a struggle just to walk my dogs 1 mile. I was really unable to golf. I slept in a chair because I was unable to lay down. I had a problem with my knee, which required knee replacement surgery. And after I went through rehab with the knee replacement surgery, I started noticing again what I thought was back pain or hip pain. From having an active lifestyle, I pretty much had to give everything that I enjoyed up. And I noticed there was an ad for iFuse with a webinar that was free to join. I was quite surprised at the information they were giving, that there was a type of treatment that could fix the problem. And I immediately made an appointment to have a consultation. The appointment was with Dr. Chowdhary. He was wonderful.
So there's really three main parts to diagnosing SI joint pain. Part one is the patient's history. When did their pain start? Did it happen after pregnancy? Did it happen after a fall or a car accident? So that starts cluing you in to that maybe their SI joint is the problem that they're having. Second, it's going to be the physical examination. And then three, it's diagnostic tests. So we send the patient off for an injection to confirm if I numb the joint, does their pain go away temporarily? We do get an MRI of the low back, we do get x-rays of the hips, and we do get an x-ray of the pelvis because we don't want to miss something else that could be causing the pain. So anytime someone has a problem, we don't want to just jump into surgery. Oftentimes you can get better without surgery. So first, physical therapy is a great adjunct to treating SI joint symptoms. In addition to that, we can send the patient off for injections, both with numbing medications to confirm the diagnosis, as well as steroids, which are really strong anti-inflammatories to help treat the symptoms.
After having my initial consultation, I started to investigate about the procedure. I did find a white paper. The company SI Bone offers an SI Buddy program. I was given the ability, if I wanted to actually speak to one of them.
So if a patient's not improving with non-surgical care and they still have persistent pain in their SI joint, surgery can be an option for that patient. That surgery can be done either in a hospital setting or in an ambulatory surgery setting where they go home the same day. They're under general anesthesia, so you're fully asleep during the surgery. A 3-centimeter incision is placed on the side of the hip, and through that incision, we're able to get down to the bone that we want to work on. And through that bone, we place 3 triangular implants across the joint to help stabilize it. So one of the big reasons I use the iFuse implant, it has the most data supporting its use. I think now there's over 175 different peer-reviewed journal articles and papers showing how efficacious it can be, both in terms of randomized control trials, safety profiles, cost-benefit analysis, survivorship.
In a few days after the procedure, the pain in my sacrum disappeared. It was wonderful for me to be able to get out there and garden and bend over without having any problems.
So one of my favorite parts about doing SI joint surgery is there's nothing more rewarding than helping someone return to a function or a functional life that they felt there was no hope.
iFuse definitely gave me my life back.